Dr. Mark Cohen is a Phoebe interventional cardiologist. We're here in our main ER to talk to you a little bit about heart attacks. Dr. Cohen, what is a heart attack? What's going on with your heart when you're having an attack?
So what basically happens is one of your arteries develops a blood clot in it. This has been a tremendous area of investigation and change over the span of my career. It wasn't that long ago in the 1970s, if you had a heart attack, we just focused upon pain relief. And people discovered that aspirin was very, very good, and blood thinners were good. And eventually you heard about these clot busters, which were designed to stop the heart attack. And out of that investigation, about the same time, these techniques to open up arteries called angioplasty came along, and we were able to develop programs to directly, mechanically open up arteries, which was proven to lower the risk of dying from your heart attack. So there's been tremendous advances over the last 30 years. We know the shorter the time you get to the hospital, the better it is. In regard to that, the Phoebe Foundation helped our local EMS companies by giving them a grant a few years ago to allow them to electronically send us EKGs from the field. So if somebody calls and the EMS comes to see you and gets an EKG, they can send it to the emergency room physicians who, if they recognize a heart attack, can start this whole process very early, because we have to call people in after hours and get people here so that we can meet you in the emergency room and get you to the cath lab as rapidly as possible to open up arteries and terminate the heart attack. In the last 30 years, the risks of dying from a heart attack have fallen from, in the 1970s, 20%, in the 1980s, 10%, currently 3% or so if we get you early,
That's amazing. What are the main warning signs of a heart attack? How do I know if I may be having a heart attack?
Well, I always tell patients, if you hurt between the Adam's apple and the belly button, if you make you short of breath, sweaty, especially sweaty or nauseated, and doesn't go away pretty promptly, you need to think it might be your heart. And I'd rather see you 10 times at night and say, no, you've got the flu or you've got an upset stomach, than have you sit at home for an hour wasting that precious time. We say time is muscle, because the closer we get you to the start of the heart attack, the more likely we are to salvage your heart muscle and keep the heart attack small.
Can those symptoms be different for men and women?
They are. Women tend to present not infrequently with weakness or pain in somewhat unusual locations. But at the end of the day, one of my mentors used to say, you know, funny stories are just bad histories. The doctors didn't ask the right question. So we're always very, very suspicious, and we have an array of things we can do in the emergency room to rapidly figure out what's going on. EKGs, blood tests, the physical examination, but we got to get to you. We got to see you. We got to get you here. And I always tell patients, again, not infrequently you'll see people, they ask their wife or they get in the car and drive themselves here. No, 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 you call 911. We've taken far too many patients out of cars doing poorly. You call 911, they'll come and get you, bring you to the hospital, and we'll get the ball rolling.
And what is your best heart attack prevention advice?
Don't smoke. Watch your weight. Take care of your cholesterol. See your family doctor regularly, because we know the things that help prevent heart disease: control of blood pressure, control of diabetes, no smoking, regular exercise, statins, those kinds of things have been shown to dramatically reduce the incidence of all cardiovascular endpoints, not just heart attacks, but stroke, and as well the risk of death.
That is potentially life-saving advice, Dr. Cohen. We appreciate it, and we wish you good heart health.